So I'm about to finish a documentary called BBC Mental, a history of the Madhouse, full documentary by J-Lo Productions. That's the person uploaded on YouTube. And in the description, it says the fascinating and poignant story of the closure of Britain's mental asylums in the post-war period. 150,000 people were hidden away in 120 of the vast Victorian institutions all across the country. Today, most mental patients live out in the community, and the asylums have all but disappeared. They talk about how patients were dumped at different institutions, different asylums, such as Hyroids. They were taken there for dubious grounds. Their family didn't want them. They wanted to support them, political reasons, what have you. I talk about ECT, electroconvulsive therapy. I talk about thoroughly in my other psychiatry series. They said that they induce seizures and to treat depression. And just like the pills, they couldn't explain how it works, but it seems to have a positive effect on depression. And this goes back to the argument I've made many times where I could hit you over the head with a hammer and your symptoms are going to go away. Does that mean that that's the best treatment? It's the same thing with electroconvulsive therapy. It's the same thing with prefrontal lobotomy, which is removing a section of the brain to treat a mental disorder. And I'm going to play some clips in a moment that show you the other things that people have been saying for quite some time, ever since these quote-unquote treatments came out, and how they added the term care. It's mental health care now, and so magically it's supposed to be better. But pretty much from the moment that Lamictal was introduced and other drugs of this nature, as which some of them still are around today, Lamictal still prescribed today, people were complaining about it. And part of what the clip will show you is how all the things that I was complaining about, long before I saw this documentary, all the conclusions from my psychiatric series were made before I seen documentaries, before I seen psychiatrists themselves saying the same thing, psychologists, healthcare professionals who had the morality to come out and speak out against their profession, really, the tactics that are being used by their fellow psychiatrists. Other ones, they've chosen to remain silent. They don't want to be persecuted. They are getting kickbacks, they're getting incentives to keep their mouth shut, and what have you. I doubt that there's many psychiatrists who are dumb enough not to know that what they're doing is wrong. That's something I extremely doubt. And it's funny, because one thing you commonly see with psychiatrists, you see this, in a psychiatrist's office, you see this newspaper thing, newspaper clipping where it says psychiatry is like a cartoon drawing, and similar to fucking, what's the guy's name, something Brown or something. I've forgotten it. Anyway, it's a cartoon drawing, it has like a lemonade stand kind of thing, and it says psychiatry 1 cent. Charlie Brown, that's what it is, similar to that, And so, to me it's really a joke, because obviously they're getting paid well. Anybody who has an office, and has a secretary, is not doing too bad, let's say. Anyway, so I just think it's very sad that while I was saying these things, everyone around me, there wasn't anyone around me who supported my point of view. Not my friends, not my family. They pretty much did what the family members of the detainees, the patients, if you will, at the Hyroids and other British asylums did. They just dumped me there. It's the same thing when they sent me to reform school, and when they agreed to have me transfer from reform school to boot camp in northern Idaho, freezing my balls off. It was just, we are going to punish you. We don't want to deal with you, first and foremost, And I could totally tell that that's where they were coming from. By the way they reacted to what was going on, they're very angry. There wasn't a single time when I was sent away to any kind of institution or reform school that my parents weren't very upset. Now, you think that's a coincidence? Or do you think that the major motivation for them sending me away is being mad at me and not wanting to deal with me rather than trying to get me help? and always they would have a very control freak attitude when they would come and, you know, work with the psychiatrist behind the scenes to determine when I should be discharged. And there'd always be deals that I'd have to make in order to fucking come back. You know, complete control mechanism, complete power play, nothing to do with mental health care. You know, that's a joke. Something that was pointed out in one of the Psych Truth documentaries, videos I watched. I'll look at my history and I'll put it in the comments. The guy said that, you know, in society, there's a very small percentage of people with genetic abnormalities, you know, and you know, usually the problems are something that happens to them. You know, they get in a car accident, or, you know, they catch a disease, the flu, you know, an STD, you know, I think they call STIs now. They, you know, they have poisoning, you know, chemical poisoning, food poisoning, or something that they take into their body, or they drug abuse, you know, which creates a biological imbalance in the mind. You know, yeah, those people, you know, people who use fucking meth for like 10 years, of course, you know, that's gonna happen. That's not me, you know. And so the majority of cases are people who something has happened to them, okay, and then they start experiencing issues. And it's the same thing he was saying with psychiatry, is that to say, you know, biological psychiatry, which is what it's called, is the prevalent form of psychiatry. And to say that he was saying to say that that the majority of these cases are biological is a joke, for the same reason to say that the majority of reasons that people go to the hospital is biological. You know, it's something, well, you know, there's some, it was genetic, you know, it's something that happens in the vast majority of cases are something that happens to them, you know, something they do themselves, something that they accidentally catch, what have you. So, you know, it's the same thing as the environmental factors which cause people to go to psych wards or to experience these quote-unquote mood disorders, really just to have a normal reaction. And it's not a biological dysfunction, as they worded it. You know, basically the same thing I've been saying for years in different words, more palpable words, you know, palpable words, more easily digested wording. So, you know, I just think it's a grave injustice what's going on here. And I think that anyone who doesn't see it my way is a traitor, especially when you're talking about your own family. You know, so a lot of you will think, why are you so hard on your family? You know, they don't deserve it. They do deserve this. They did have their own reasons for doing this. They did have motivations, dishonorable motivations for doing what they did to me. They knew damn well that when I was younger, for instance, that I, you know, Maria, when I was 15, wasn't the first female that broke my heart. You know, I was having problems. Environmental factors were taking its toll on me when I was younger. When I was when I first went to kindergarten, I stood outside, you know, and I cried, you know, because I got there late. I was the last person there. Everyone, you know, all the pressure was on me instead of just like everyone else, you know. So that's how I was introduced into one of the first, you know, social environments that I was in, which made me what? Inclined to be antisocial because of the experiences, because of the environmental factors, you know. So out of all three of my brothers, I was the one who went late to fucking kindergarten, and I was the one who developed the fucking complex that made me antisocial compared to them, made me shy. Well, not really antisocial, but shy. Ironically, I would then become one of the popular kids because of my sports achievements, and then people, you know, I was a leader that people would follow. That's a story for another day. I want to wrap this up. I have clips I got to play, and I got to keep this on 15 minutes. So, you know, I just think it's very sad that you have a lot of bootlickers and traitors taking the sellout's point of view. Anytime you see people taking the status quo, the greedy, the fucking aristocracy, the plutocracy, the kleptocracy's point of view, you have to ask yourself why. Are you stupid? Or have you decided it's in your best interest, which is despicable, disgraceful? I always say, and I'm going to end this with this, you know, before I play the clips, I always say it is much more honorable to be ignorant than it is to be deceitful and playing stupid. Thank you.
For many patients, the tranquilizing drugs were causing new problems. They are basically sedative drugs, but they produce a very special sort of sedation, which is a bit like having Parkinson's disease. So that not only do they sedate you, but they make you physically rigid, and they physically slow you up, and they mentally slow you up.
To me, it was like the system came down on me so heavily straight away. It was just, you know, as if things like drugs and shock treatment was the answer to my unhappiness or whatever, which it certainly wasn't. It made things a lot worse.
Now, this reminds me of Dr. John Breeding when I first saw his videos, and I first saw the videos of Thomas Zaz and them. I was saying, these people are saying exactly what I'm saying. Look at what this guy says. I mean, he takes the words out of my mouth, yet he said them long before I did. Well, long before I said them on record, for sure. And most likely before I was born.
Under this radical new thinking was the controversial psychiatrist R.D. Laing. His books and speeches outlined a new approach to treatment, in which the patient, not the doctor, knew best.
But they wish I wouldn't blow the gaff and shoot my mouth off on television and to the public at large. And this is exactly what I think that any of us who have got dissent within our particular professions ought to do.
His books and ideas caused a sensation. The general thesis of the politics of experience is that we live in a mad world, and that a normal response to a mad world is to be mad, and that the sanity that most of us manage to maintain is actually the more abnormal sort of response.
Now, I think that anybody who's looked into this at all knows that that is absolutely correct. Think about how the people who don't have incentives from the pharmaceutical company, you know, the more moral of the psychiatrists have come to this guy's conclusion. Think about how I came to his conclusion. How there was a huge outcry among patients that doctors were using medicine as psychiatric medication as a blunting instrument, is the words they use in this documentary. I mean, if you go to Psych Truth channel, he has over 1 million subscribers. There are tons of people who know that this is the truth. And there's a bunch of drug addicts, a bunch of trolls, a bunch of fools, a bunch of mental health, quote unquote, experts who go out of their way to try to create the facade, the illusion that, oh, we know best and that there's something wrong with you. And this also absolutely verifies my assertion, my postulation, my hypothesis, if you will, that we are living in a society that is screening out the better people, the more righteous people, and it's filling the world with Babylonian scum and a bunch of gold-digging whores. If you look at this lady right here, yes, she's dressed kind of nice. Yes, she's dressed presentable, but her hair isn't really done like a Hollywood actress. You know, she's not really done up. Because that's pretty much what a pretty righteous lady looks like these days. Those days and these days, whenever this documentary was made. Do you see what I'm saying? We live in a very materialistic, evil world. It is evil to be materialistic. It is evil to see madness and hell on earth being carried out and to feel nothing, to not be disturbed. And you're going to hear a bunch of scum come up with a stupid argument. Well, maybe we're just tougher than you. So when you walk by somebody suffering, you know, on the side of the street and you don't help them out, you're tough, right? It's dumb motherfuckers. Yep.
Like flies, and I'm still looking for a way to make us wise.